Hello, I'm Dr. Victoria Sorley Aguilar, Feminine Flame MD, and today I'm going to take a few minutes to talk about something super important for a woman's life. Many women have heard about menopause, but many women are not aware of genitourinary syndrome of menopause, which can impact up to 80% of women and create serious changes in her body that have serious implications. So it is worth taking the time to empower ourselves with wisdom because wisdom is power. Knowledge is power. When we're informed about the changes in menopause, we can make good, healthy decisions about how to take care of our bodies during menopause. Menopause is when it's been 1 year since our final menstrual period, when our ovaries stop producing estradiol, which is the body's natural form of estrogen. When that happens, we're in a low estrogen state, and that can impact us from head to toe because we have estradiol receptors in our body from head to toe. It can give us insomnia and moodiness. It can give us hot flashes and night sweats, and it can cause genitourinary syndromes, which is everything below the belt. And we're going to talk about that in detail. Again, it can impact up to 80% of women. And unlike hot flashes, which can sometimes go away on their own, usually genitourinary symptoms do not go away on their own. They're progressive over the course of a woman's menopause. Low estrogen in menopause can cause vaginal dryness, burning, and itching, thin, weak, and fragile vaginal tissue, which can lead to less sensation, less libido, less orgasm. It can also cause burning with urination, urinary urgency and frequency, which means needing to pee more urgently and more frequently, sneezing and peeing, which means when you might cough or sneeze or laugh, you might leak a little urine, and more frequent bladder infections. Estradiol is protective to our vaginal and bladder health. So when we're in menopause and we have less estradiol, a woman becomes more susceptible to bladder infections. When women are in late menopause, because they have less sensation in their vulvar and urethral tissue, they can have a bladder infection without even being aware of it. And sometimes the only clue that an older woman has a bladder infection is because she becomes severely weak, severely ill, and winds up hospitalized. So it's so important that we're aware of the changes that happen to our body with menopause so that we can make informed decisions. Treating genitourinary syndrome of menopause can prevent future urinary tract infections. How do we care for our vulvas and vaginas? We can use plenty of lubrication during sex, like KY jelly, which we can pick up at the pharmacy without a prescription for like $10. We can use vaginal moisturizers. I've used an example here of Replens, but there's many different brands, very, very cheap, again, without a prescription, and can be used several times a week to help the vagina with moisture. We can also talk to our doctor about low dose vaginal estradiol, and I'm going to talk about that in depth. How do we care for our bladder and our pelvic floor muscles? Our pelvic floor muscles are so important because they're holding up our bladder and they're holding up our uterus, and they do all of this without us even thinking about it. So how do we take care of them? Well, we can work on Kegel exercises where we tighten our pelvic floor muscles. If we don't know how to do that, or if we want a little guidance, we can ask our doctor to refer us to a pelvic floor physical therapist. These are physical therapists who are specialized in the pelvic floor, and they can help us train to strengthen those muscles. We can also talk to our doctor about low-dose vaginal estradiol because it also supports the bladder and pelvic floor muscles. Low-dose topical vaginal estrogen is not the same as systemic menopause hormone therapy. Low-dose topical vaginal estrogen is not systemically absorbed the same way that menopause hormone therapy is. Its effects stay in the genital, bladder, and vulva tissue where the medication is placed. And that is why it is safe for most women. Now, there are some women that cannot use low-dose topical vaginal estrogen, and that's women who have active breast cancer or a history of estrogen-dependent cancer. So if a woman has a history of breast cancer or actively has breast cancer or any other kind of estrogen dependent cancer, she will need to talk to her gynecologist and talk to her oncologist about whether low dose topical vaginal estradiol is safe for her. Low dose topical vaginal estradiol is prescription only, easy to use, and has many benefits. It can bring about less urinary incontinence, less urinary tract infections, more vaginal lubrication, healthier vaginal tissue, and more pleasure with intimacy. It can be applied 1/2 to 1 gram to the inner labia, urethra, and clitoris twice a week. It can be applied using a vaginal applicator, which inserts the cream into the vaginal canal, or it can be applied by putting a pea-sized amount on the finger, again, and applying to the inner labia, the urethra, which is under the clitoris, and the clitoris tissue, and right into the vaginal walls. Other forms of low-dose vaginal estradiol are the vaginal pill, which is a 10 microgram pill that can be inserted twice a week. It costs about $40 a month. Imvexi, which is an estradiol capsule, which comes in 4 and 10 micrograms, which is also inserted to the vaginal canal twice a week. It's about $250 a month because it's brand name. The estradiol ring runs about $500 a month, and this is in a 0.2 milligram ring, which is inserted into the vaginal canal every 3 months. This is really good for maybe elderly women or women that are in a nursing home that don't have the dexterity or can't remember to place the ring. It can be placed by a healthcare provider and replaced every 3 months. This is a diagram showing how the tablet or cream is inserted into the vaginal canal with an applicator. And this is also showing how the vaginal ring sits inside of the vaginal canal and is replaced every 3 months. Remember, this is not intended to be individual medical advice. It is for educational purposes only. Please talk to your healthcare provider about whether low-dose vaginal estradiol can help you. And if you want more information, you can subscribe to my YouTube channel at Feminine Flame MD. You can also go to my website, feminineflamemd.com, for more videos on menopausal health and sensual wisdom. Thank you so much for watching.